Women and children living in humanitarian settings are the most impacted by sexual and gender-based violence. For refugees and displaced persons, there are many reasons for this, including gender inequity and low levels of income, social support, and mental health. To explore ways to prevent sexual and gender-based violence in humanitarian contexts, we turned to Uganda, Sub-Saharan Africa's largest refugee hosting nation, with over 1.4 million refugees. We go particularly to Bidi Bidi, Uganda's largest refugee settlement, with over 200,000 residents. In 2019, the UNHCR reported 4,452 cases of sexual and gender-based violence in refugee settlements in Uganda. There were likely more that went unreported due to sexual violence stigma. That's attitudes and beliefs toward sexual violence that can create barriers to disclosure and accessing support. This includes HIV testing and post-rape care such as post-exposure prophylaxis or PEP and emergency contraception. This can have devastating long-term consequences on youth's physical and mental health. To develop and pilot test an intervention that could help prevent sexual and gender-based violence, we sought to understand stigma experiences of refugee youth. We looked at evidence-based approaches for interventions to preventing sexual and gender-based violence. Building on this evidence base, we developed a sexual violence prevention intervention with refugee youth in Bidi Bidi in the form of a participatory comic. Comics, that's the bringing together of visuals and text to convey emotions and meanings, are youth-friendly, low-cost, low literacy, and scalable for providing education and inspiring empathy on emotionally difficult and stigmatized issues. Graphic medicine uses comics in motivating behavior change, increasing knowledge, and reducing stigma across a range of health issues, populations, and contexts. To begin, we worked in partnership with Uganda Refugee and Disaster Management Council, or URDMC, who work on the ground in Bidi Bidi. Through URDMC, we recruited and trained refugee youth living in Bidi Bidi with lived experience of sexual violence as peer navigators. To be sure the comics were contextually, gender, and age-tailored, peer navigators, supported by senior research coordinators, first facilitated focus groups to understand sexual violence drivers and facilitators. They then conducted individual interviews to explore post-rape clinical care experiences and recommendations with refugee youth, elders, healthcare providers, and police in Bidi Bidi. The research team worked together to do a thematic analysis of this qualitative data. From this, we developed 8 scenarios for the comics. The initial comic scenarios were shared with peer navigators, elders, healthcare providers, and police officers for feedback. All feedback and suggestions were integrated in the final version of the comic book. Each scenario in the comic book has additional information or practice tips. The comic book includes some blank scenarios that were later used in a workshop as part of our study. For our intervention, we held 7 one-day workshops, 6 with refugee youth and 1 with healthcare providers from Bidi Bidi. Youth aged 16 to 24 were divided into 3 workshops for adolescent boys and young men, and 3 for adolescent girls and young women. First, participants learned lessons from interactive group activities, including role-playing, on the impacts of sexual violence and related stigma, key tips about PEP, and bystander practices. That's when people witnessing violence take action to help the situation. Next, they looked at the comic books and discussed each scenario with their group and facilitator. Then, using the blank scenarios in the comic book, they created their own solutions and stories for the comics. To support participants, collaborators were fluent in local languages and could provide support services, for example, in mental health. To evaluate the impact of the comic intervention, we did a survey before, right after, and 6 to 8 weeks following the workshop. This included an open-ended question about participants' experiences of the workshop and what they learned. Among participants, we found significant increases right after the workshop and in the follow-up 8 weeks later in PEP knowledge and acceptance, bystander efficacy, and resilient coping. PEP for post-rape care was new information for many participants. We also found significant decreases in sexual violence stigma and depression. Qualitative feedback revealed knowledge and skills gained to engage with post-rape care and violence prevention, and increased empathy to support survivors in terms of stigma and in linking to health and police services. We found no significant differences in the intervention's effect between young women and men, suggesting the promise of this approach across genders. In future, it will be important to see how this intervention affects youth with different social networks or experiences of stigma, and also to compare results with a control group of youth who don't engage with the comic book. This pilot study and comic book can be scaled up to a large, full-scale, randomized, controlled trial across other humanitarian contexts, and can inform policies on how comic book strategies can be integrated into school health curricula for sexual and gender-based violence prevention. Our findings can also influence PEP information and delivery for youth in humanitarian contexts, and by healthcare providers for rape survivors. For example, methods could be integrated as a tool to complement the MISP implementation. Within Bidi Bidi and beyond, our aim is for all persons, regardless of gender and age, living in humanitarian settings, with sexual and gender-based violence and stigma less of a concern, to be able to develop healthy and fulfilling lives, knowing they are valued, strong, contribute to their family, have a voice, are changing the cycle, are respected in their community, and have a bright future.